And this is not to discriminate against old
No,
people.
no, no,
That's
no, no.
reality.
65 and up, you're at high risk. You have diabetes, you're high risk. You have heart disease, high risk. If you're pregnant, you're high risk.
Mm.
So everybody should be taking the precautions of being at least six, like social distancing. Oh my God, please practice social distancing. Do
Mm.
not be going out, hanging out with your friends. Don't be going out to the beach. Don't be going like a couple of weeks ago when this thing first hit, people were going to concerts, and I was just like, "Are you serious? Like, why do you think Louisiana and New Orleans got hit so bad?
Mm.
Mardi Gras. People were not practicing social distancing in Mardi Gras. You can be, so there's a term called asymptomatic carrier. That means that you can have the virus, and for 5 to 7 days, you can carry the virus and you can give it to other people, look just fine,
Wow,
and not be sick.
that's scary because you never know. You know.
Exactly.
Mm.
Exactly. And there's a shortage on the tests. So the best way to figure out who's a carrier is to get everybody tested. But we have so many people here. Maybe in the future, maybe in a month or two, we can get enough tests going on. But
Mhm.
the best way to protect yourself is social distancing.
So no more dawats.
No more dawats, please.
Yeah, that's the
No
hard
more dawats.
one.
Maybe you can do some FaceTime dawats. I don't know.
That's what my kids have been doing. We haven't been letting them meet their friends, so they're just every other
Yeah.
day just kind of FaceTiming
Yeah.
each other and
Some Zoom dawats, I'd be down with some Zoom biryani. I'd be down for that.
so what are like fomites?
So a fomite is something that it's an inanimate object like a desk or like a mouse or a cell phone, and it carries a virus. It can carry a virus, right?
Really?
Yeah. So studies have shown for COVID-19, the virus can live on an object for up to 9 days. So in your home, to maximize protection and safety, you guys should every day you should be at least wiping the doorknobs. You should be wiping the counters. Heavily trafficked areas, you should be wiping off with like an alcohol wipe or some kind of like Clorox. So just to um, make sure that nobody is bringing the virus from the outside, and if somebody is, you can just clean it off and just kill the virus there.
So that would include your shoes too. Like you're coming in from outside or something like that, and you can probably carry that on your shoes.
I mean, if somebody sneezed and their stuff went onto your shoes, it could carry it up to 9 days. So I mean, I don't really touch my shoes that often, but
Mhm.
if you want to, yeah,
Because sometimes you walk into the house, right, and like kids are running around, they're just like slipping and sliding, and then like
yeah, clean your shoes.
mhm, I see. And okay, then because is there any like because recently Trump has been saying that there's some sort of drugs or vaccine. I mean, is there any truth to that, or what's going on with the medicine or vaccine situation? Mhm.
So there's clinical trials going on right now with an antiviral. It's I mean, there's very like spotty data
Mhm.
out right now. Some people it helps them recover. Some people it doesn't. I would not bank on it right now, and even if you can, I don't know if it's going to be available like widespread out. So there's it's called remdesivir. It's created by the Gilead pharmaceutical company. It has shown some promising data, but not like too convincing, right?
Mhm.
Um, there's another one like hydroxychloroquine or Plaquenil. Those are malaria drugs. Some people actually were eating the tablets that you use in an aquarium, and they died actually. I
Yeah,
don't know if
because
you've heard
like,
about that.
what if we take like like some people may have some leftover antibiotics or like we shouldn't be doing any of that stuff, right?
No, I mean, again, there's another study that shows azithromycin, which is a Z-Pak, which you take for like an upper respiratory infection. Um,
Mhm.
you tag team it with an anti-malarial drug, and it's been shown to help patients
Mhm.
clear the disease. But but it's not really clearing the disease. It's clearing out the bacterial pneumonia that happens on top of the viral infection. So what happens? So kind of going to the side real quick. So if you have the virus, it gives you an increased chance of getting bacterial pneumonia, right? A super infection. And that's when people get really sick. And so depending on your age and some like your factors, if you're immune compromised, if you've been on steroids, or if you've been treated with chemo, things like that, everybody has a different amount of immune system strength, right? So some person can get the virus and just have a normal cold and be done with it. But you don't know. That's not guaranteed, because I've read about young, healthy people that are 18 years old, 21 years old, clean bill of health, no past medical history, get it. And then in like 7 days, they get to the hospital, and then astaghfirullah, they passed away too. So it's hard to say how some of these people are getting infected, but people should not be saying that, oh, I'm 18, I'm like indestructible, I can do whatever I want.
Yeah,
No.
that's a lot of
if you compare the patient population from China and the US, more younger than 59 years of age are getting more infected here in the US compared to China, which attack more of the elder population. Okay. So when, say for example, if you get the virus and you have the bacterial pneumonia, then you can take an antibiotic. That can help you. But at that time, you would probably start having shortness of breath. Then that's when you need to go to the ER immediately. So talking about this a little bit, like we can just talk about the symptoms. What symptoms you can have that should be a red flag, right? So fever is huge, with cough. And this is a very specific kind of cough. It is a dry and hacking cough, okay? So fever, dry hacking cough, and then shortness of breath. People in the beginning of the disease stage can also present with some sore throat as well.
I see.
You know?
Okay.
So this can, if you're starting to have shortness of breath, you should go to the ER, get checked out. They'll probably do some tests and see what your oxygen levels are, right?
And so, because I hear some people say that, you know what, more people die of the flu than they die of.
Oh yeah.
You know.
Oh my God! Thank you so much for bringing that up. So when this first started, this whole pandemic situation first started, everybody in the U.S., CNN were saying, "Oh, don't worry about it. This is just a random virus. It's just going to go through. It's nothing. It's not going to stop It's not going to stop like our life. It's not going to affect us. It's the flu infects more people. The flu kills more people. So we're not worried about the flu, right? So why are we worried about this random virus?" That's what the conversation was about 2 months ago. And I told all my friends and I told all my family, I was like, no, please do not don't believe that. Do not go into that, because the flu data is showing now that the flu is not as infective as the COVID-19.
Oh.
It's not. And it lasts longer on fomites that we talked about earlier. It actually, there's a concept called R naught, which is a calculation that you do for infectious diseases, and it tells you how much can one person infect, how many people can one person infect, right? And then so the R naught basically tells you the infective value of a disease, and the COVID-19 has a higher R naught than the flu. Okay, so that's one thing. So it's more infectious. And we also talk about the mortality rate, which is also the death rate, right? The flu's mortality rate is about 0.1%, which is nothing compared to the COVID-19. COVID-19's mortality rate, or the death rate, is about 3 to 4%, right? Now it changes. So in 100 people, 3 or 4 would die. 3 or 4 would get, if you get a random 100 people, 3 or 4 people would get the pneumonia, and then they would further decline, and then they would pass away. Now, that rate is different in different countries. In Italy, it's a higher rate, right? Other things that make it higher is if you have diabetes. Diabetes, you have 7% mortality rate, because if you have diabetes, you're immune compromised, right? So anything that you have that makes you immune compromised puts you at an increased risk for getting complications. So do not compare the influenza virus to the COVID-19, because they're different animals and they require different ways to protect yourself, you know?
Yeah. I mean, the biggest thing for me, at least. People could on, like, there's other sicknesses, people, die more, they're more, severe than this one. I guess, like I said, it's just a lot of misinformation. People think that, hey man, I take my Flintstone vitamins, I'm good. I can go outside and nothing's gonna harm me.